Chronic pain is a widespread and challenging condition, affecting nearly a quarter of adults in the United States, with even higher rates among older women and those living in rural areas. Neuropathic pain, a severe form of chronic pain, arises from damage or disease affecting the nerve system, and is often linked to conditions like diabetes, nerve injuries, or post-surgical complications. This type of pain can be persistent, function-limiting, and significantly impact quality of life. Additional treatments, including medications and physical therapy, often fall short, especially for those with moderate to severe symptoms. As a result, there's a growing need for innovative solutions that go beyond standard care. This sets the stage for exploring advanced interventions like peripheral nerve stimulation, which offers hope for those whose pain remains uncontrolled. Peripheral nerve stimulation, or PNS, is a minimally invasive technique that targets nerves outside the brain and spinal cord to manage chronic pain. The concept dates back over 50 years, but recent advances have made PNS safer, more effective, and FDA cleared for a variety of pain conditions. Modern PNS systems use small electrodes placed near the affected nerves, delivering gentle electrical pulses that disrupt pain signals before they reach the brain. This approach is especially valuable for patients with neuropathic pain, such as those suffering from complex regional pain syndrome, post-amputation pain, or chronic low back pain. Unlike opioids, PNS is non-addictive and can be tailored to each patient's needs. The American Society of Interventional Pain Physicians has developed evidence-based guidelines to help clinicians select the right candidates and optimize outcomes, making PNS a promising option for those with persistent pain. Effectiveness of peripheral nerve stimulation is supported by a growing body of research, including randomized controlled trials and systematic reviews. The latest guidelines emphasize the importance of careful patient selection, trial stimulation, and ongoing education. For most candidates, a successful trial showing at least 50% pain reduction is required before permanent implantation. Guidelines also address safety, device selection, and management of potential complications, such as infection or lead migration. Importantly, PNS is now recommended for a wider range of conditions, including craniofacial pain, phantom limb pain, and chronic low back pain. The American Society of Interventional Pain Physicians rates the evidence as fair, with moderate strength of recommendation, reflecting both the promise and the need for continued research. By following these guidelines, clinicians can help more patients achieve meaningful pain relief and improved quality of life. Patient education is a cornerstone of successful peripheral nerve stimulation therapy. Before undergoing the procedure, patients receive detailed information about how the device works, what to expect during and after implantation, and how to manage their device at home. They are also counseled on realistic expectations. While many experience significant pain relief, outcomes can vary. Postoperative care, including wound management and activity guidelines, is essential to minimize risk. Patients are taught to recognize signs of complications, such as infection or device malfunction, and are encouraged to maintain healthy lifestyle habits to support their recovery. The guidelines also provide clear recommendations for managing medications, especially blood thinners, around the time of the procedure. With proper education and support, patients are empowered to take an active role in their pain management journey, maximizing the benefits of PNS. Peripheral nerve stimulation continues to evolve, with new devices and techniques expanding the possibilities for chronic pain management. As research advances, more patients are likely to benefit from this technology, especially those who have exhausted other options. The integration of PNS into clinical practice is guided by robust evidence, expert consensus, and a commitment to patient-centered care. By staying informed about the latest guidelines and innovations, healthcare providers can offer hope and improved quality of life to those living with chronic pain. The journey toward better pain control is ongoing, but with tools like PNS, the future looks brighter for patients and clinicians alike.